Hello, I'm Michael O'Toole, and welcome to our Digital Health Pioneers podcast. I think we can all agree that healthcare is struggling. We've got major shortages in staffing. On top of that, we have a higher demand for healthcare services, and it's a turning point for us. So one of the ways that we can solve that problem is through the use of technology. And that's really what this podcast is about, is how are people using technology to handle this new demand with less resources? I'm really excited to share with you a success story from Waterbury Health. Our guest, Bryan, is going to be telling us about a very simple solution, actually, to a very common problem in healthcare, which is around getting real-time feedback from your patients while they're in the hospital. Welcome, Bryan. We're excited to have you.
Thanks for having me, Michael.
So, Bryan, before we get into it, and the topic today, by the way, is around innovative technology solutions to service recovery, which is very important in healthcare. And when patients have a bad experience, how do we ensure that we can turn that around? So, Bryan, before we begin, if you could just give us a little bit about your organization, so they have no size and scope, and then kind of your title and role in the organization.
Sure. So thanks again for having me. My name is Bryan Graven. I'm the executive director, CIO of two health systems in Connecticut, Waterbury Health and Eastern Connecticut Health Network. Between the two health systems, we have three community hospitals and over 70 locations. Prior to this role, I managed a healthcare MSP at a company called National Physician Services, where we helped out hospitals and medical groups.
Great. And I saw Bryan speak at a HIMSS conference, which is kind of what precipitated this discussion. And I was so impressed with the technology that they've implemented. Um, so, Bryan, tell us a little bit about the problem that this technology and solution was aimed to solve, and maybe give our listeners a little bit about the pain points and issues around the current state that led you to this new technology solution.
Sure. So if I can back up a little bit, um, I mean, our star rating and patient quality is really important to us. And both of the hospitals that I oversee are three-star hospitals. And from that perspective, the administration, the staff, we are dedicated and very interested in improving patient experience, not only for our community, but also to increase that star rating. Really important to us. We want to make sure that we're giving the best patient experience possible. That said, typically when a patient has a bad experience in the hospital, what we were noticing, and most hospitals go through this as well, is that you receive feedback after the patient's been discharged. Don't get me wrong, there's times where a patient will be in the hospital and they'll voice a concern or complaint. But if they're receiving let's just say a survey in the mail, typically those surveys happen 1 to 2 weeks after post discharge, and there's little to nothing that we can do once they've left the building, so to speak. So we came up with an approach called patient service recovery. And patient service recovery is all about keeping tabs with the patient while they're in the hospital, so we can take more of a proactive approach to turning around that patient experience while they are in the hospital, and avoiding that post discharge kind of area where we really can't do much about their experience at the time.
Yeah, so it's really interesting because that there's a physician that I learned this from. I think it was Dr. Paul Batalden. It would say, one of the biggest impediments in healthcare to driving improvement is this lag in data. And here's a great example of it where they fill out the form well after, and then the hospital doesn't even receive that information right away either. And so there's this big lag. So tell us a little bit about how you selected this technology and and what it actually does to help kind of solve that problem of, getting more real-time feedback.
Sure, sure. So we did vet out vendors for this technology, and we ended up partnering with the company called Highlight Health. That partnership was more around customizing a solution that really fit the mold of what the administration thought would work for a hospital environment. We've all been part of. We've all stayed at nice hotels, and you receive a message when you check in, and you're able to rate your experience 1 to 5 stars. We took a very similar approach, trying to keep the process simple, and we um, incorporated a star rating along with a feedback area specific to what the problem or issue may or may not be. And upon patient check-in, we send the message while the patient's staying in the hospital. So day one, day two, day three.
There's a
Yeah,
text message
these
that
are
there's
these are
yeah.
yep, these are text messages sent right to the patient's mobile device, and they have the opportunity to respond to those text messages and provide real time feedback. And based on that feedback, let's just say it's a bad experience that they're having. That message is then triaged to a nurse manager or somebody at a leadership level to work with the department or the team to try to turn that patient's experience around. So it's become a kind of an invaluable asset of ours. Just imagine being a patient, and I mean, for better or worse, sometimes things don't go right. And if you have that mechanism where you can easily text message a somebody and say, "Hey, it's, I need some help here," and it's not that the administration or the staff doesn't want to help. Sometimes they don't know, and this gives really that transparency, that safety net to the patients, so that they can get that real time action and have somebody come in and turn around whatever issue that they're having.
Excellent. So the platform itself is text messaging to the patient, and then how are the leaders notified or triaged? Is that via some kind of interface within on their desktop, or is that also on their phones, or how does that work?
Yeah, so it is integrated within the hospital system,
Okay.
but what we're doing here is we're either text messaging or emailing a group of individuals who are on the service recovery list. So we know exactly where that patient is in the hospital, um, all the details around that patient, so that when they do get that message, they can follow up with that patient immediately. And it's something that has been reinforced throughout our organization. It's something that our leadership team and our managers take great pride in.
That's great. And could you give the listeners maybe a sample success story where, an actual one that maybe was brought up after implementation where a patient was dissatisfied? What did that look like? What was like a real world example where, you did have a good outcome?
Sure, I think some of the common ones that you'll typically see is wait times. Perhaps there's a patient hasn't seen a nurse, or they feel that they haven't seen one in a satisfactory time, and they need something. It could be anything. Could be perhaps they need a charger for their phone. There's a lot of different situations here. We have all the standard stuff like everyone else. We have a nurse call system, but there's certain times where a patient wants to use a different avenue, and this technologies allows them to use that other avenue. So let's just use that example that they needed a charger for their iPhone. Not that it's a patient care type issue, but our team receives that information, and you're able to turn that around really quickly and address that patient's issue, and hopefully help them out.
Yeah. No, that's great. I like also the connection you made to, checking into a high-end hotel or even an Airbnb now. They kind of give you that five-star rating. And one thing that's coming uh, that I'm curious about is do you have the ability to track the response rate? Like how many of your patients are actually responding and to the original text that goes out to say, how was your initial experience? Is that, because a lot of times with text messaging, you can get low response rates or.
Yeah, yeah, we were really thrilled around the response rates, and I think the notion of sending text messages when a patient has a bad experience is one sided. I'd say like 95% of the time, patients are actually texting to say that they're having a great experience and they're providing positive feedback. So it's really reinforcing the level of care that our healthcare providers are delivering. Um, so I think that that's an important element right there. But back to your question, I'd say about it's like 30 to 40% of patients, while they're in the hospital, are typically responding to one of the messages that they receive, which is a pretty good number.
Yeah, that is actually very good. It's higher, much higher than I was thinking it would be. Um, and then when you implemented this technology, did you turn it on at all facilities? Did you pilot it somewhere first, or how did you scale it?
Sure. Great question. So, what we did is we implemented it within a few departments.
Okay.
And we tested it to make sure that the text messages were going to the right people. Uh,
Mhm.
have a small control group to be able to do that. And once we felt comfortable that the messaging was working, that the open rates were good, and we were getting feedback, we decided to roll this out throughout the entire hospital. Fast forward to where we are today, we've had partners of ours roll out similar technology using the same vendor, and it's really creating a really nice feedback loop between the healthcare providers and the patients in a different format than what you typically see.
Yeah. What are some of the kind of surprises that you came across after implementing this technology?
I think just overall, the adoption was really nice to see,
Yeah.
not only for patients but for the staff as well. Um, I think a lot of healthcare providers take pride in providing excellent patient care, and sometimes they don't know when something is wrong with the patient. This gives them a kind of a safety net with the patients, and it allows them to really look after those patients who may not be having a great experience. So just the administration and also our staff really embracing the technology. I think that's been great to see.
Great. And do you have any other outcomes around the project, some measures that you could share demonstrating the improvement?
Yeah, so I have seen over the course of the last year. So we've been on it for about a year.
Okay.
I have seen a positive increase in our Press Ganey scores,
Oh,
which I
interesting.
think is really what you're hoping to expect from.
Yeah.
And I think you have to attribute that to the technology, to the healthcare providers and the staff, really trying to be better than they were yesterday or the year before. We've also implemented some other technology tools. We've done digital rounding, which I think is important.
Hmm.
And we're always looking for that next thing that's going to help our healthcare providers take that patient experience to the next level. So there's a couple pilot programs that we have going on, but there's just a lot out there right now that we're considering, but all in an effort to improve patient experience.
That's great. As you were discussing, I was curious what the lift was like from an operational standpoint. Did it really change the current workflow that much for the nurses and staff, or, um, you know, and maybe if you describe the exact process when a patient, let's say, comes into the ED, how do they get the phone number? How does it get added to the system to begin the text messaging system or whatnot?
Yeah. So what's great about the platform is that once the integration is complete with the
Uh-huh.
hospital system, as soon as that patient is registered within the system, we have their contact information, so we can provide an outreach to that patient. So from a onboarding or implementation perspective, it's a really easy, seamless integration process, which you would expect with any type of hospital technology. And that's something that was really important to us. That and obviously cybersecurity to make sure that it had all the cybersecurity protections along with it. But the once we had it integrated, we did a couple week trial with a smaller department, and we wanted to make sure that it was contacting the patients in the appropriate way. We have designated messages for when a patient checks in, their first day in the hospital, their second day in the hospital, upon discharge, and so forth. So all of those messages had to be sent to that patient succinctly. So we went through that whole testing process, and once we found that it was working, and we had confidence and the patient was receiving the appropriate messages, then we opened it up to everybody. So that was if I had to put a timeline on it, I'd say it was probably around a 6 week process.
Oh, okay. Yeah, so that's pretty quick. It seems like it would be kind of a low lift workflow, which is always great for the operational teams. And what would you say were some of the barriers that you had? I was thinking a little bit about, I'm sure there's a set of your population maybe that doesn't have a mobile phone number, or they're, at a state where they're not going to necessarily be able to respond, but maybe I have a family member who can.
Sure.
Tell me a little bit about some of the barriers and maybe some of those situations and how you may have put in solutions around that.
Sure. So we weren't necessarily concerned about a patient not having a cell phone. I think everybody, for the most part, has a cell phone these days, even our elderly populations. Um, but we were concerned about some of the language barriers within our hospital. We, serve a diverse community. We have Polish, we have Spanish, we have lots of different nationalities in our community. And what was great about the system is that it also has a translation on it as well. So no matter what native language you want to hear the message or read the message in, you can hear it in that native language, and you can respond in your native language, and it will actually translate it back into English. So that was a very powerful feature, and one that I thought was terrific considering our diverse community that we serve. So little things like that, that was kind of a big win. It was unexpected as well, that it came with that level of technology.
Great. And do the nursing units, I know a lot of times with all the Press Ganey data, uh, nursing units look at that data, each month and try to figure out improvement plans to help improve patient experience. How are the nursing managers and units using any of this aggregation of the data in any way to help, either reinforce the great work that the unit is doing or identifying areas for improvement?
Yeah, so I think what this technology has allowed us to do is identify areas in the hospital that can use improvement, and there more than likely is a good correlation between what you are seeing in service recovery results and also the Press Ganey reports. The difference is when you receive a service recovery message or you're able to trend with service recovery because it does come with the same level of analytics, you can do something about that real time, right? And the benefit to that is hopefully by the time the patient takes that Press Ganey survey, you've turned around their experience, and now they are saying something that's positive about your facility and your hospital versus something negative. And I think that is tremendous, tremendous.
Wow. Well, I really think the solution is such a great solution for a problem that many health systems suffer from. So, and seems a bit simple, right? But yet very effective. Is there anything else, Brian, that you want to tell our listeners that we didn't get to talk about in terms of this success or failure, and or lessons learned, or even someone else is embarking on this? What advice would you give them?
Sure. So it's just not the technology; it's how you handle the service recovery. Um, we were fortunate enough to adopt the Cleveland Clinic heart model for patient service recovery, and it's been not only a technology transformation, but also a culture transformation and how we address patient concerns. I think when you blend both the technology and culture or process improvement together, that's what really makes the technology work, and it makes the difference in your hospital.
So could you tell us a little bit more about that model? Maybe just at a high level, what all it entails.
Sure. So it's a proven model for patient service recovery. It stands for hear, empathize, apologize, respond, and think.
Okay.
It's really a process that I think we all intuitively do, but it really maps out that process. So you're actually thinking about that process when you are working with that patient to turn around their experience.
That's great. So it's really, as you mentioned, kind of the combination of training and getting that new model operationalized, plus the use of this technology that likely has helped increase your Press Ganey scores, it sounds like.
Absolutely.
Great. Well, thanks so much for your time here, Brian. Really appreciate learning a little bit more about how you've implemented a fairly simple solution to a very common problem that a lot of large health systems are facing. Um, and with that, we'll wrap it up. And thank you so much.
Great. Thanks for having me.
Thank you for joining us today. I'm Michael O'Toole, and don't forget to hit subscribe so you can hear future episodes of our Healthcare Pioneers podcast.